Hi, my name is Steph. I'm with WellnessFirst Chiropractic, and I want to talk with you today about subluxation. January 8th is Show and Tell at Work Day, so we wanted to do a little demonstration about what chiropractors do and the basic principle of chiropractic. So on my finger, if you can see it, I have a rubber band right here, and it's going to illustrate a subluxation. And what subluxation means is minor misalignment. Like sub means minor, lux means to dislocate. So it's a minor dislocation, not like a shoulder injury or something like that you would see on a football field, but just a minor misalignment of the spine or any part of the skeletal structure. So I'm going to leave this here for a little bit, and we're just going to talk about subluxations. And you may say, oh, well, I don't have anything going on. I'm fine. I don't have any of those. Well, actually, the first subluxation can occur at birth. You think about all the little things that babies' little bodies have to do to get into this world, and sometimes they pull the babies out by the head, or there's a lot of pressure going on, or they turn the neck funny. That can cause a subluxation. If you've ever been in a car accident, or if you've ever played sports, you probably have some subluxations. If even just learning to walk, children fall about 2,000 times just learning to walk. Or you think of all the things that kids do to their bodies, learning to ride a bike, all the times that they fall. Those can cause subluxations. And just because you don't have pain doesn't mean you might not have subluxations. So we're going to talk about this a little bit. And what a subluxation does, if you can see it. There, I'm going the wrong way. There we go. You can see that my finger is starting to turn red. It's starting to get itchy and numb. And it's basically this rubber band is cutting off circulation, for one. And for two, it's cutting off connection to the brain. Like my brain is now sending it signals, hey, heal this spot. It hurts. Or do something to this because it needs some oxygen somehow. So my brain is sending it signals, and the rubber band is stopping it. This subluxation is stopping it. So I could give this little area a shot and see if that helps it feel better. I could massage it a little bit to see if that helps it feel better. I could take a pill to see if that helps it feel better. But ultimately, this subluxation is still here. So what I would do is I would go to a chiropractor and have them remove the subluxation. And my brain is going to tell my finger to heal itself. So by doing this, and allowing the body to heal, my finger is going to get numb again because it's getting blood flow back to this. I'm going to get normal color, and it's going to feel better in about 2 or 3 minutes. So I have a happy, healthy little finger because we've removed the subluxation. So that's what chiropractors do. That's the only thing we do is we remove subluxations and allow your body to heal itself. So think of all the different ways that you can turn your head, and if something is kinked in here, you can definitely tell it, right? So you can turn your head sideways, you can turn it back, or you can tilt your head, right? So each vertebrae here can actually subluxate on 3 different planes. So, like I just said. So, all the different things that your vertebrae have to go through to keep you healthy and to keep your body communicating with the brain and the brain communicating with the body, that's what we do. I'm with WellnessFirst Chiropractic. We offer chiropractic and massage therapy, physical rehabilitation, and spinal decompression. And the reason we offer those other therapies is because once you align the bones and remove the subluxations, you have to rehabilitate the body. Through stretching and all sorts of different other tools that chiropractors have available. So when you would come into our office, you would come in and maybe get x-rays and talk with the doctor and do a complete history. Doctors will ask you questions going clear back to your childhood because they want to know what your body's been through. So they'll do a complete history with you, and then they'll bring you in for a report of findings where they would go over everything that they found and what they think the course of treatment would be for you specifically and for your body. Most chiropractors operate this way, and so if you are not close to one of our clinics, I would definitely encourage you to go talk to a chiropractor near you. But this is just an example of what we do, and just wanted to get that out there. So thanks for listening today.